Hey everyone, welcome back to Financial Futures. Have you ever wondered if you can qualify for both Medicare and Medicaid at the same time? Well, you're not alone. This is a great question, and I'm here to walk you through all the details you need to know to make the most out of these two essential healthcare programs. Before we dive in, make sure you hit that like button and subscribe if you haven't already. If you know anyone who could benefit from this information, please share the video with them. Now, let's get into it. Alright, let's address the big question first. Can you get both Medicare and Medicaid at the same time? The answer is yes. And the truth is, millions of Americans are currently benefiting from this very combo. In fact, over 14 million people across the country are enrolled in both Medicare and Medicaid. So, if you're eligible, you could be too. But let me clarify how these two programs work together and what that can mean for you. Medicare and Medicaid serve different purposes, but when combined, they can offer extensive healthcare coverage. Medicare primarily covers those aged 65 and older, or people under 65 with certain disabilities. On the other hand, Medicaid is a need-based program that assists low-income individuals with healthcare costs, including some expenses that Medicare doesn't cover. So, if you qualify for both, the combination can help reduce or even eliminate a lot of your out-of-pocket healthcare costs, which is fantastic news, right? But, and this is important, not everyone is eligible for both. Eligibility depends on a few key factors, such as income, assets, age, and disability status. Don't worry, I'll break it all down for you. If you're 65 or older, or under 65 and receiving Social Security Disability Insurance, SSDI, you may already qualify for Medicare. But how do you know if you can also get Medicaid? Well, that's where income and asset thresholds come into play. Let's talk numbers. For individuals, your monthly income generally needs to be below $1,275 to qualify for Medicaid alongside your Medicare coverage. The asset limit is around $9,340. That includes things like money in your checking or savings accounts, retirement accounts, and any investments you have. Now, for married couples, the income limit is higher, between $1,724 and $2,320 per month, and the asset limit is around $4,130. Just keep in mind that your home, one vehicle, and certain burial expenses are usually not counted as assets. Why does this matter? Well, while Medicare covers a significant portion of healthcare expenses, it doesn't cover everything. Think vision, dental, and long-term care, for instance. Medicaid can help fill those gaps, covering things that Medicare won't, like co-payments, deductibles, and long-term care services. So if you can get both, it's a huge advantage in minimizing healthcare costs. Let me give you a practical example. Let's say you're an individual receiving $900 a month from Social Security. You might think, great, my income is below the Medicaid limit. But if you have $25,000 in a savings or retirement account, that's where you could run into issues. Even if your income qualifies, having too many assets can make you ineligible for Medicaid. That's why understanding both the income and asset limits is so important. One or the other can disqualify you from additional coverage. Now, I know this is a lot of information, but don't worry, I'm here to help. If you're feeling unsure about where you stand in terms of income, assets, or eligibility, you can always reach out to your local Medicaid office or healthcare advisor to get personalized advice. There are resources available to guide you through the process and make sure you're not missing out on any benefits. And here's the big takeaway: if you're eligible for both Medicare and Medicaid, it can truly maximize your healthcare coverage and reduce your out-of-pocket costs. And with healthcare costs being such a huge concern for many, having this double coverage can make a world of difference to your financial security and overall peace of mind. Whether it's covering prescriptions, hospital visits, or long-term care, these programs working together could mean huge savings for you. As always, if you have any questions about the details I covered today, whether it's the income limits, asset thresholds, or how to apply, drop a comment below, and I'll be sure to get back to you. I'd love to make a follow-up video. Before you go, don't forget to subscribe so you can stay informed about important financial and healthcare updates like this. There's a lot of info out there, and I'm here to help you navigate it all. Plus, check out the videos linked here for more tips on maximizing your benefits and securing your financial future. Thanks again for watching Financial Futures. Share this video with your friends and family who might find this information useful, and I'll see you in the next one. Stay informed, stay secure, and as always, take care of your financial future.